Welcome to the Dr. Izzy's Medical Podcast channel.
Question: how do acetylcholinesterase inhibitors influence Lambert-Eaton syndrome? Answer: minimal to no effect. Question: what does the E in CRESS syndrome stand for? Answer: esophageal dysmotility. Question: which tumor is associated with the tumor suppressor gene WT2? Answer: Wilms tumor, nephroblastoma. Question: which pancreatic enzyme is the most specific diagnostic serum marker in acute pancreatitis? Answer: lipase. Question: what is anaplastic tissue? Answer: abnormal tissue, cells that lack differentiation. Question: besides TDT, what surface receptors do T-cell lymphoblasts express? Answer: CD2 to CD8. Question: what is the most common cause of infective arthritis in sexually active young adults? Answer: Neisseria gonorrhoeae. Question: what immunohistochemical marker is used to DX rhabdomyosarcoma? Answer: Desmin. Question: what is the third gene mutated in the adenocarcinoma sequence? Answer: P53. Question: which lymph nodes does cancer from the lower one-third of the vagina spread to? Answer: inguinal nodes. Question: what is the risk for invasive carcinoma associated with atypical hyperplasia? Answer: 5x increase. Atypical hyperplasia can be ductal or lobular and involves significant atypia. Question: how does the ST segment shift in transmural myocardial infarction? Answer: ST elevation. Question: which lung cancer is associated with adrenocorticotropic hormone secretion? Answer: small cell carcinoma of the lung. Question: which gender exhibits a higher risk of suicide completion in depression? Answer: men. Question: which modification to the tau protein is associated with Alzheimer's disease? Answer: hyperphosphorylation. Question: which cause of restrictive lung disease in neonates is associated with surfactant deficiency? Answer: neonatal respiratory distress syndrome. Question: which pattern of necrosis is characteristic of ischemia at the lower limb and gastrointestinal tract? Answer: gangrenous. Question: which cancer is associated with the tumor marker beta-HCG? Answer: hydatidiform moles, choriocarcinoma, testicular cancer. Question: what change regarding our ET causes multiple endocrine neoplasia, MEN2A, MEN2B? Answer: point mutation. Question: what serum tumor marker is associated with poor prognosis neuroblastoma? Answer: neuron-specific enolase. Question: which ECG leads will show pathological Q waves in an anterior wall infarct? Answer: V1 V4, anterior precordial leads. Question: how does pulmonary wedge pressure change in acute respiratory distress syndrome, ARDS? Answer: normal PCWP. Question: which pattern of necrosis is characteristically seen in malignant hypertension? Answer: fibrinoid necrosis. Question: which complement protein complex lyses microbes by creating a hole in the cell membrane? Answer: MAC. Question: which cancer is associated with aromatic amines, for example benzidine, 2-naphthylamine? Answer: transitional cell carcinoma of the bladder. Question: what are the lines of Zahn? Answer: alternating layers of platelets, fibrin and RBCs in a thrombus. Question: where in the body do osteoblastomas commonly arise? Answer: vertebrae. Question: which basal ganglia structure sees depigmentation and a loss of neurons in Parkinson's disease? Answer: substantia nigra. Question: which genus of bacteria is associated with an alkaline, odorous urine with NH4? Answer: Proteus sp. Question: what is the estrogen level in patient with hypothalamic suppression? Answer: markedly low. Question: which age group is commonly affected by senile osteoporosis? Answer: greater than 70 years old. Question: which cancers are associated with cigarette smoke? Answer: carcinoma of the oropharynx, esophagus, lung, kidney, bladder and pancreas. Question: what type of crystals are involved in gout? Answer: monosodium urate. Question: what is the cause of nasal inflammatory polyps? Answer: recurring, chronic rhinitis. Question: what does the lumen of the neural tube become? Answer: ventricles and central canal. Question: which is classically the first hormone to become deficient in hypopituitarism? Answer: growth hormone. Question: what is the most common type of pathological change in premenopausal breasts? Answer: fibrocystic change. Question: what type of autoantibodies are associated with drug-induced SLE? Answer, antihistamine antibodies. Question, what gene is involved in inherited breast and ovarian tumors? Answer, BRCA1 and BRCA2. Question, how do you differentiate between a migraine and subarachnoid hemorrhage? Answer, subarachnoid hemorrhage has a sudden onset. They are both vascular in nature. Question, what level of mitotic activity of a tumor is associated with a high risk of metastasis and aggression? Answer, high. Question, how does bleeding time change in disseminated intravascular coagulation? Answer, increase. Question, what is the most common cardiac tumor? Answer, metastasis from melanoma, lymphoma. Question, which type of inflammation arises in response to tissue necrosis? Answer, acute inflammation. Question, which hormone secreted by small cell carcinoma of the lung can cause syndrome of inappropriate secretion of antidiuretic hormone as a paraneoplastic syndrome? Answer, ADH. Question, what morphological change in alveolar macrophages is seen in chronic left-sided heart failure? Answer, hemosiderin-laden macrophages aka heart failure cells. Question, what kind of pneumonia does Staphylococcus aureus cause? Answer, bronchopneumonia. Question, what is the cause of hyperlipidemia and hypercholesterolemia and nephrotic syndrome? Answer, compensation by the liver for lipiduria. Question, what serum marker is elevated in endodermal sinus tumors? Answer, AFP. Question, which adhesion protein is lacking in the malignant cells of lobular carcinoma in situ? Answer, E-cadherins. Question, which type of gastric adenocarcinoma is associated with chronic autoimmune gastritis? Answer, intestinal. Question, what demographic of women is commonly affected by phylloides tumor? Answer, postmenopausal women. Question, which enzyme involved in heme synthesis is defective in acute intermittent porphyria? Answer, porphoblinogen deaminase. Question, which type of cardiac infarct involves ST elevation and pathological Q waves on an ECG? Answer, transmural infarct. Question, which neoplasm is associated with autoimmune diseases? Answer, lymphoma. Question, what is the drug of choice for the long-term prevention of deep vein thrombosis recurrence? Answer, warfarin. Question, which type of seizures affect one area of the brain? Answer, focal, partial. Question, what does a nutmeg liver indicate? Answer, chronic hepatic congestion. Question, what is the normal function of Neurofibroma 1? Answer, it is a gap that regulates signal transduction by inactivating RAS. Question, what type of shunt is involved in an atrial septal defect? Answer, L2R. Question, what is the etiology of thrombotic thrombocytopenic purpura? Answer, deficiency or defect in the ADAMS13 protease due to autoantibodies, thereby leading to overactive von Willebrand factor. Question, in which period in gestation will teratogen exposure result in an increased risk of organ hypoplasia? Answer, months 3 to 9, second and third trimesters. Question, which bone cancer has an increased risk of occurring in Paget disease of bone? Answer, osteogenic sarcoma, osteosarcoma. Question, how does arterial oxygen saturation change in methemoglobinemia? Answer, decrease. Question, which type of tissue is associated with keratin? Answer, epithelium. Question, how should 1 unit of packed RBCs raise HCT? Answer, 3%. Question, what translocation involving CMYC will cause Burkitt's lymphoma? Answer, T8, 14, to an Ig heavy chain locus. Question, what genetic defect occurs during the hyperkeratosis stage of oral squamous cell carcinoma? Answer, inactivation of P16, via loss of 3P and 9P21. Question, which dopamine pathway of the brain is associated with the positive symptoms of schizophrenia, hallucinations, delusions? Answer, mesolimbic. Question, what is the most common congenital male reproductive abnormality? Answer, cryptorchidism. Question, what gene mutation is associated with achondroplasia? Answer, fibroblast growth factor receptor 3, the mutant receptor is constitutively active and inhibits chondrocyte proliferation. Question, what is the etiology of DiGeorge syndrome? Answer, 22q11 chromosomal deletion. Question, which hormone secreted by renal cell carcinoma can cause polycythemia as a paraneoplastic syndrome? Answer, erythropoietin. Question, which type of nephrolithiasis can be seen in primary hyperparathyroidism? Answer, calcium oxalate stones.
Thank you for listening Dr. Izzy's medical podcast series.
If you want to support this project, please subscribe the channel and like this video. Thank you.